Have you ever been told that it's all in your head? Let's talk more about that on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got Tina Nunziato sitting here by my side. Maybe you're watching us on YouTube. You could see us live. That's awesome. Actually, it's not live. I apologize, but you can see us. So it's great to have you on this show. If you're a first-time listener, we welcome you. If you're one of our regular listeners, we thank you. We appreciate that you continue on this journey with us because it is a journey. That's what life is. So, what about that little phrase, it's all in your head? Is that something that you've ever heard? Has anyone ever told you that? A doctor, a provider, ever said, hey, you know what? I don't know what's going on.
We've worked you up. We can't find anything wrong.
Yeah. So maybe they don't directly say it's in your head, but maybe subtly, subconsciously, there's insinuating, you know what? I've done everything I can. You've had a Rolls Royce workup and everything is negative and I don't know what's going on with you.
Mm-hmm.
Okay. Some patients through the years have told me that they were told it was all in their head. And so, yes, I have heard that from patients. I'm sure you've heard it from clients that you've taken care of.
Yeah, by the time they get to me, they've usually been worked up by multiple people and they can't find what's wrong.
Right. So that's actually the reason, or one of the reasons, that Tina and I started on this wellness journey over 15 years ago. Okay. Because I was doing these workups on patients that were coming in to see me. And maybe I was their first gastroenterologist. Maybe they had seen another or two other gastroenterologists and had had a similar workup. And all sorts of tests, blood tests, CAT scans, ultrasound, endoscopy, colonoscopy. I mean, you name it. Some of these patients had the workup done 2 or 3 times and nothing had been found, and been prescribed these different medicines, like candy, and still coming in with the same symptoms. Okay. If you've ever heard our story, I basically came to Tina one day and I said, I don't know what to do. I have these patients that I've done a full workup. Some of them have seen another gastroenterologist and had the same workup. I've prescribed these medicines. They're still not feeling well. And I feel stuck, like I can't help them, but I want to help them, and I couldn't give up on them. That's not in my nature. I keep going and I wanted to help them. And that was the birth of our wellness journey. When Tina was like, I don't know, you're the doctor. And I was like, well, I don't know. I must be missing something. And there were a lot of pieces that were missing. In medical school, the nutrition class that I got was a morning, half a day. And it was basically just the vitamins. That was really the extent of the nutrition that I got. And even as a gastroenterologist, going through 3 years of fellowship, really there wasn't a lot in regards to diet, nutrition. Yes, high fiber diet, eat nuts and berries and seeds. But there really wasn't much more. There wasn't like a class on nutrition that we would take for a semester or for, 6 months, nothing like that. And I suppose it's because we did have dietitians, and if we needed anything having to do with the diet, we wanted the patient to be counseled, we would send him to the dietitian. So that's pretty much it, but when Tina and I started on our wellness journey, we realized, I realized how much I didn't learn in all of my medical training. And I learned a lot. There was so much volume to learn. But there were things that we didn't get that were really crucially important, like on nourishment, on nutrition, on, just overall wellness and what we're eating and the importance of what we're putting in our body. That there really wasn't an emphasis on that. Okay. And I have had patients who I have sent maybe to another doctor to get a second opinion. And they come back and we're talking about their diet, and they will specifically tell me straight out, oh, I asked that doctor about my diet, and they said, oh, you could eat whatever you want. It doesn't impact your disease. Okay. So we've heard that. I've heard that multiple times throughout my career. I'm sure you've heard it doing
Yes.
wellness with the wellness clients. But it does matter. Okay. So these patients that we were doing these workups on, that I would work up, put on all sorts of medicines, still coming in with the same GI symptoms, digestive symptoms. It was like, what's going on? And so that's what Tina and I set out to find out, to research, and over the course of years ended up putting together our wellness program, which has helped so many of our patients and clients, because we have a lot of wellness clients that are not necessarily patients, that weren't patients in the practice, but that found us online or through friends that maybe were our patients, friends and family. And so, when patients tell me, and I'm sure you feel the same way when clients tell you, I've been told it's all in my head, like that actually makes me very sad. And makes me even more want to try to figure out what's going on with them. And so, a lot of these clients, these patients and clients of ours that have been told that, who have then started working with us in the wellness business, where we put them on digestive enzymes, put them on probiotics, maybe do a food sensitivity test on them, and lo and behold, find that they have multiple food sensitivities. Okay. I'm not talking about allergies. I'm talking about sensitivities. And where we're like, okay, you've got to eliminate this out of your diet. You've got to get on these enzymes, these probiotics, this detox, this greens. We guide them and we help them, and they have like a miraculous recovery, feeling so much better, like coming back and thanking us and being like, you don't know how many workups I've had, what I've been through, how many different medicines I've been on.
Yeah, I think because the standard of care right now is run these tests. And I think the tests are really geared toward finding, let's say, like major disease. Okay.
Right.
And a lot of people don't have major disease, right? They just have maybe a lack of enzymes. Maybe their bacteria is off balance. But the traditional testing that's out there right now is looking for cancer. It's looking for tumors. It's like, right? Most people don't have those things. So, and then the other part of medicine that's happening, the traditional side of medicine, is it's very much medicine based. And what I mean by that is like prescribed medicines or over-the-counter medicines. Okay. When you went to med school, you told me that a lot of it was very driven by the pharmaceutical companies, right? These people are there, they're taking you out to dinner. They're like, hey, if you diagnose this, give this medicine. If you diagnose this, give this medicine. The first step is always to give a medicine, which most of these medicines, especially in gastroenterology, digestive issue world, are just band-aids covering up the problem. They're not really fixing the problem. And I think that's probably the same for even cardiologists, for example, where we're giving people high blood pressure medicine and high cholesterol medicine. It's just a band-aid. It's not really fixing the problem, right? So we get on these medicines, and because it's just a band-aid and it's not fixing the problem, it's not fixing the problem.
Right.
And people are still coming back. And then they're like, well, we've run all the tests, and if this medicine doesn't work, we don't know what else to do. It must be in your head. No, it doesn't have to be necessarily in your head. You literally could just have an imbalance in your bacteria. You literally could just not be making enough enzymes. And that's a simple fix.
Yeah.
Okay. It's so simple. It's just that that's just not what doctors are trained for right now.
Absolutely. I mean, it's true. We're not a traditionally trained MD or DO. Well, doctors of osteopath actually do have like they learn how to do manipulation of the spine, the skeletal system. They learn that, which I think is awesome. but in general, the traditionally trained MD, we're trained how to prescribe medicine. Okay. Now, it is very possible. I mean, I don't know what the curriculum is now for medical school. Maybe they are incorporating more in the way of a holistic, a branch of holistic approach, or more functional, addressing the more functional type stuff. But in general, the way I was trained, because it's been over 20 years, we very heavy on learning the different medicines, prescribing medicine, and it's not to say that there's not a role for these medicines. Okay, I mean, hey, since the discovery of antibiotics, of penicillin and antibiotics, I mean, many people have been saved from a serious infection. So there is definitely a role for medicines, and so it's not to bash it. However, there are medicines that are being used and that we use in even gastroenterology, where we are just basically like putting a band-aid on the symptoms, and not really getting to the root cause. Okay, and our point is that there are things that we can address where we can get to the root cause that will actually help many people that have digestive issues feel better. Okay. How do we know? Because we've seen it. Okay. We've seen it in our practice. I've been practicing I'm a traditionally trained gastroenterologist, and I've been practicing gastroenterology for over 20 years now. And we've had our wellness business now for over 15 years. And so we've been taking care of patients and other wellness clients, for over 15 years, over 10
decade.
years, over a decade, and helping them to get to the root cause, helping them to get to the root cause. As simple as it may sound. I mean, for some people, just putting them on some good, healthy probiotics, good, healthy bacteria has helped them. For others, putting them on digestive enzymes, where now it helps them digest their food and they're not getting bloated and getting acid reflux and feeling that indigestion, because now they're actually digesting the food. And because they're digesting the food, they're also getting the nutritional benefit from that food.
And then taking it one step further, people who are struggling with anemia,
right?
Low energy, getting them on the greens, helping them not only with enzymes to digest their food properly that they are eating, but getting them taking that extra boost of greens that their blood and their body needs so badly to help just get the body feeling better again. So you're not tired all day. You don't have foggy brain, right? All of these things that, like those kind of symptoms where doctors are like, oh, you're fine. You're fine. Well, no, I don't feel fine, right? I feel like I'm sluggish. I have low energy. Like, that's all normal. But there are things you can do to fix that.
Absolutely. And so the point of what we're trying to say, with these people, we have seen many patients, clients who maybe are not patients, but have found us, through the wellness business, and who have been told, I was basically told, this is in your head. Okay, this is in your head. You don't have anything going on. Who we've been able to help. Okay, we've been able to help them with these simple things that we're talking about. It's amazing how many food sensitivities we diagnose or we find. Okay, we find in these wellness clients and patients that have the food sensitivity test. I mean, a lot of them will say, well, I've already been tested for food allergies. But the traditional testing that is done by a traditionally trained allergy specialist isn't actually going to detect these food sensitivities. And people have a lot of food sensitivities because of the American diet. If you're here in the USA, I mean, our American diet is not the greatest. Okay. I mean, and you may be in another country. Okay. But in general, the food these days, even if you're eating a healthy plant-based diet, I mean, the plants, the vegetables that are grown in the soil is more nutritionally depleted than it was 50 years ago. And so a lot of people have developed food sensitivities through their years, and a lot of them aren't even aware of it. And when you mention it to them, sometimes they're a little skeptical, and then they agree to go ahead and do the food sensitivity, and lo and behold, they've got all these sensitivities, and you go and tell them, get off of these foods, and all of a sudden they're feeling better. I mean,
and that could be just temporarily too. Like
yeah.
you don't have to be off those foods forever. It's just until we can get the gut to heal, right? So that's the other thing we've talked about, and we've talked about in previous podcasts. But it's just so important to get these other tests done that are not part of traditional medicine, more of a naturopathic approach to looking at these things, to considering supplements instead of the medicine all the time. I feel like if patients are open to that, they tend to get better faster.
Right. Yeah. So if you are someone that, has been made to feel bad or guilty because of your symptoms, or maybe you weren't told directly, it's all in your head, but the way that they said it basically insinuated that, connect with us. I mean, and let us help you. And you can find us on our website, drlizcruz.com. There's a magenta colored button on the homepage that you can click and schedule a free 30-minute wellness consult. And that's right, it's free, and it's a 30-minute wellness consult done over the phone, so you can do it from anywhere in the world. And that's our gift to you. And we have a lot of free resources on our website too. So check us out. And if you have not rated us, please rate us, and please give us a 5. It'll help other people just like you to find us faster. And lastly, if you have not subscribed to this podcast, please subscribe so that you never miss an episode. Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.